Have you ever caught yourself doing something and thought, huh, where did I pick that up? Like a gesture or a way of talking, and you suddenly realize, oh, it's totally from so-and-so.
Yeah, it's amazing how much we just absorb by watching other people, isn't it?
Totally. And today, we're going to really unpack that. It's all about observational learning and, the whole fascinating world of how our attitudes and behaviors can actually shift and change over time.
Definitely key stuff to grasp, especially for those of you gearing up for the MCAT, right? These psychology concepts are, well, they're crucial for understanding how humans tick.
Big time. So we've got a ton to cover, and I'm actually really excited about this one. We're going super deep, not just on learning by observation itself, but also, what's going on in our brains to make that happen.
Yeah, and we'll be digging into those major psychological theories too, the ones that explain, the why and the how of those thought and action changes. Goal is to equip you with a really solid understanding, make these concepts crystal clear, all super relevant for the MCAT and beyond.
So where do we even begin with something like this? I mean, what exactly is observational learning? Can we define it simply?
For sure. Basically, observational learning boils down to this. You learn by watching others, and then, potentially, you imitate their behavior. You'll hear this called modeling a lot, and it's honestly one of the most fundamental ways we develop, especially as kids, right? Think how much we learn just by watching. Nobody's directly teaching us.
It is kind of wild when you think about it that way. Like a kid learning to talk or even, I don't know, how to use a fork.
Exactly, and there's so much of that happening early on. Think of a little kid watching their parent in the kitchen, parents stirring something, topping veggies, maybe tasting the food, adding spices. Later, you see that kid playing with their toy pots and pans, and they're doing the same stuff, stirring, chopping, the whole bit.
It's like their little brains are recording everything. They're just sponges.
Totally. It just highlights how powerful observation can be. We pick up on so much just by watching.
It's almost like we're constantly taking mental notes on what other people are doing, right?
Yeah.
Speaking of mental processes, let's do a quick little check for you all listening. What term do we use when we talk about learning by watching others? Is it A, reinforcement, B, habituation, C, modeling, or D, conditioning? Think about it for a second. Okay, the answer is C, modeling. So we've got those basics down. But what's happening in our brains that actually allows us to learn this way? Is there something specific going on?
Now that's where things get really interesting. It all comes down to these specialized brain cells called mirror neurons. And the coolest thing about these neurons is they fire not only when we perform an action, but also when we see someone else doing that same action. Our brains are essentially mirroring what we're seeing.
Right. But hold on. So if I watch you reach for your coffee cup, the same neurons are firing in my brain as if I was reaching for it? That's pretty wild.
Exactly. And it goes way beyond just imitation. This mirroring is crucial for us to understand and even feel what others are experiencing. It's deeply tied to empathy, that whole ability to put ourselves in someone else's shoes, and also how we interpret their emotions.
Oh, wow. So that's why we cringe when someone trips and falls. Our mirror neurons are firing as if it's us wiping out.
Precisely. And what's really significant is how this biological mirroring might be a foundation for social connection and understanding, Maybe an evolutionary advantage, helping us predict and respond to how those around us are feeling.
So it's not just learning a skill, it's about connecting with other people on a deeper level. That's pretty profound when you think about it. You mentioned vicarious emotion earlier, too. Does that tie in here as well?
Oh, absolutely. Vicarious emotion is basically, feeling an emotion yourself just because you're witnessing it in someone else. Could be fear, embarrassment, even joy. Our brains, thanks to those amazing mirror neurons, can essentially simulate the experience we're observing. We connect emotionally without actually going through it ourselves.
So that's why we tear up during sad movies, even though it's not our life falling apart on screen.
Exactly. Our brains are creating that feeling within us.
So we've got this core process of observational learning. Our brains are wired for it. Where else do we see this playing out in the real world beyond, kids mimicking their parents?
I mean, honestly, it's everywhere. Think of healthcare training, right? Medical students spend tons of time shadowing experienced physicians. They observe everything, routine checkups, surgeries, the whole 9 yards. This direct observation is huge for their learning, picking up those practical skills and seeing how decisions are made in real time.
It's so true. That was a big part of my pre-med experience, too, just watching and absorbing everything I could. What other areas are kind of heavily influenced by observational learning?
Well, the media, for one. Think about how trends in fashion, even the way people talk, Or like certain behaviors, especially risky ones, they can spread so quickly through exposure in movies, TV, all over social media. These platforms are full of models, both good and bad examples, that people observe and might then imitate. It really highlights how much influence role models have, whether it's a real person or a fictional character.
It's like that saying, monkey see, monkey do,
Yeah.
but applied to everything.
Exactly. And then, of course, parenting is still a big one. Kids are watching their caregivers all the time, modeling all sorts of behaviors from good stuff like kindness and teamwork to, well, sometimes less desirable things, too.
Makes you realize how important it is to be mindful of what we're modeling for the younger generation, doesn't it?
It really does. What we do has such a ripple effect. And, another place this comes up is in therapy. Observational learning can actually be used strategically there.
Oh, interesting. Tell me more about that.
Well, say someone has really bad social anxiety, they might benefit from watching, like, their therapist or someone else who's comfortable in social situations, seeing how they start conversations, that eye contact, how they respond to different cues. It gives the person with anxiety a model to work from, to approach those same situations themselves, and then they can practice those behaviors they observed.
That makes a lot of sense. It sounds like a really versatile tool. All right, time for another quick knowledge check. Which brain structure is most directly involved in vicarious emotional learning? A, hypothalamus, B, corpus callosum, C, mirror neuron system, or D, cerebellum? And the answer is C, that mirror neuron system again. Okay, we've established how we learn by watching. Now, I want to shift gears a little and talk about what actually makes us change our attitudes and behaviors more broadly. Like, what are the driving forces behind those shifts?
Right, because understanding observational learning is just one piece of the puzzle. We also need to delve into those broader psychological theories, the ones that explain the mechanisms behind how our attitudes and behaviors change. There are a couple of key frameworks to grasp here, and they're particularly relevant for the MSAC.
Okay, give us the rundown. What are these big theories?
So the first one is called the Elaboration Likelihood Model, usually shortened to ELM. This model basically describes two main routes we take when we're processing a persuasive message, and how those different routes can lead to changes in our attitudes.
Two routes, huh? Sounds intriguing. Break it down for us.
So we've got the central route and the peripheral route. When we process information using the central route, we're engaging deeply with the actual content of the message, analyzing the logic, weighing the evidence, forming our opinions based on the strength of the arguments presented. This deeper level of processing usually leads to attitude changes that are more enduring and resistant to change later on.
So, like, if I'm really paying attention to the facts and the logic behind an argument, I'm taking that central route. What about the peripheral route? How's that different?
With the peripheral route, you're more focused on cues that are, well, they're more superficial, more about the style of the message than the substance. Things like, how attractive is the speaker? Do they seem credible? What's the emotional tone of the message? Even just the sheer number of points made, regardless of whether those points are actually strong. This kind of processing tends to result in attitude changes that are more temporary and less resistant to future persuasion attempts.
Gotcha. So central is all about the meat of the argument, while peripheral is swayed by those external factors, those more superficial things. Can you give us a real-world example to kind of illustrate both of these routes in action?
Sure. Imagine a public service announcement trying to convince people to wear seatbelts. A central route approach would present hard data stats on how effective seatbelts are at preventing injuries and deaths, citing research studies, using logic and reasoning. This requires the audience to really think critically about the information. On the other hand, a peripheral route approach might just feature a really popular celebrity saying, buckle up, it's cool. It relies on the celebrity's image and influence rather than hard facts.
Ah, so I'm more likely to be swayed by the celebrity, even though it's not a very strong argument logically.
Yeah.
Okay, that makes sense. What's that other key theory you mentioned? The one besides the ELM?
Right. The other big one is Albert Bandura's social cognitive theory. Now, this framework builds upon those principles of observational learning we talked about earlier, but it takes things further. It incorporates other elements that impact our behavior and how our attitudes change.
All right, fill us in. What are these additional elements we need to be aware of?
One core component of social cognitive theory is this idea of self-efficacy. It's basically our belief in our own ability to succeed in specific situations, to do what needs to be done. If we have a strong sense of self-efficacy, we're much more likely to try something new, to stick with it even when things get tough. This I can do it Mindset is really powerful.
So it's like an internal sense of confidence in our own abilities.
Exactly. And social cognitive theory also emphasizes reciprocal determinism. It's understanding that our behavior, our personal factors, thoughts, feelings, beliefs, self-efficacy, and our environment, they all interact and influence each other. It's a constant loop.
Not just one thing dictating the others, but a whole dynamic interplay between them all.
That's really interesting. So where does observational learning fit into this bigger picture of social cognitive theory? It's a central mechanism. We learn by observing others, but whether we actually adopt those behaviors we've observed, well, that's influenced by a lot of things, including our level of self-efficacy. Do we think we can do it? And the context of our environment matters too. Like, if you see someone successfully quit smoking, it might boost your own belief that you can quit too, especially if you've got supportive friends and family.
So everything is connected. It all ties back together. I love how these pieces fit. All right, let's test your knowledge again, shall we? Another pop quiz. In the elaboration likelihood model, which route involves deeper thinking and typically leads to longer-lasting attitude change? Is it A, peripheral, B, central, C, emotional, or D, automatic? Take a moment to ponder. And the answer is B, that central route. All right, so we've looked at these big overarching theories of attitude change, but what about the specifics? What are the factors that actually make us more or less likely to be persuaded by something?
Yeah, that's a great next step. There are several factors that really influence how easily our attitudes can be changed, and we can categorize them into, characteristics of the message itself, characteristics of the source delivering that message, and characteristics of the target audience, which in this case is you, the listener.
So let's break it down. What are some of the things that make a message itself more persuasive?
First and foremost, clarity. A message needs to be clear, logically coherent, well-structured. If it's all over the place, confusing, doesn't make sense, well, it's not going to be very persuasive. Emotional tone is also a big deal. For some issues, a strong emotional appeal can be super effective. It grabs attention and drives change. For other issues, a more factual, objective approach might be better received. It really depends on the context.
So knowing your audience and tailoring your message accordingly is key. What about the person or group delivering the message? What makes a source more persuasive?
Source characteristics are huge. Think about credibility. Is the speaker seen as knowledgeable, trustworthy, and expert on the topic? That makes a big difference in how we receive their message. Perceived trustworthiness matters too. Do we believe they have our best interests at heart? Are they biased? And even things like attractiveness or likability can come into play, especially when we're talking about that peripheral route of persuasion.
It's funny how those more superficial qualities can still have an effect, even if we're not consciously aware of it. So, last but not least, what about the person on the receiving end of the message? What are some of those target characteristics that influence how we're persuaded?
Yeah, with target characteristics, it's all about the individual. Their education level and prior knowledge on the topic are important. That shapes how they process the information. Their mood at the time can even play a role. Like if someone's in a good mood, they might be more open to certain types of persuasion. And maybe the biggest factor is their level of personal involvement. If the topic directly affects their life, their values, they're way more likely to engage deeply using that central route we talked about.
So it's not just about the message or the messenger, it's about the receiver and how they filter and interpret everything. Can you give us a final real-world example that kind of brings all these influencing factors together?
Okay, picture an ad campaign for healthy eating. If the message clearly explains the nutritional benefits of certain foods, backs it up with science, that's clarity and logic, and it features respected health professionals, source credibility, it's got a much better chance of being persuasive. But how much impact it actually has, well, that might depend on the audience. Someone already health conscious, actively looking for nutritional info, they'll probably process it through that central route. But someone who's not so interested in healthy eating, they might be more swayed by peripheral cues like how delicious the food in the ad looks.
It all makes so much sense when you break it down like that. Wow, this has been an incredibly informative deep dive into observational learning and attitude change. I feel like we've covered so much ground. Let's do a quick recap of the key takeaways to really cement everything we've learned. We started with observational learning, that idea of learning by watching and imitating others, then explored the amazing role of mirror neurons in this process and in how we experience those vicarious emotions. We then dug into the elaboration likelihood model with those two paths of persuasion, central and peripheral. We tackled Albert Bandura's social cognitive theory, emphasizing self-efficacy and that interplay between behavior, personal factors, and the environment. And finally, we examined all those different factors that affect how easily our attitudes can be changed, focusing on the characteristics of the message, the source, and us, the audience.
Right, and as you prep for the MCAT, remember, it's not just about memorizing definitions. It's about using these psychological principles to understand how people behave, which is fundamental to medicine, really.
So, for all of you listening, take a minute and think back to a time when you learned something new, maybe a new skill, or you changed your mind about something important to you. Can you spot any elements of observational learning or those principles of attitude change at play in that experience? What does it tell you about how you learn and how you're influenced by the world around you? It's really insightful when you start seeing these concepts happening in your own life.
It is. It's like that aha moment. And keep thinking about these topics.
Yeah.
Apply them to what you see happening around you. And remember, truly understanding these fundamental aspects of psychology, well, it's going to be invaluable, not just for the MCAT, but throughout your medical careers as you interact with patients, colleagues, everyone.
It's all about understanding the human element. Thank you so much for joining us on this deep dive. Until next time, keep those brains buzzing.